Usually it's the husbands pressuring the wives to go get abortions. The extreme case I've had is a man not only telling his wife to go have an abortion, but actually buying a random street side abortive pill, making his wife take it, and she ended up in our emergency department bleeding into her uterus.
Ladies and gentlemen,
Hey guys, welcome back to the channel. It's another episode for another day, and today we're going to handle a weightier topic, and it's caused a lot of division, a lot of dividing opinions, a lot of backlash and all of that. But as someone that has a medical background and experience dealing with a lot of abortion cases, both pre-abortion and even post-abortive care, I'm actually not really here to give much of an opinion, but more of to share a story. There was It was an interaction that took place earlier this year. So basically, I was on night duty at the hospital, and I had this young female patient walk into my office, and she sat down. And the first thing I noticed about her was that she was hyperventilating, hysterical a bit, breathing or rather struggling to breathe very loudly. And I was very concerned. Obviously, I was thinking maybe this is an emergency case at first, but I wanted to be sure. So I decided to check her vitals myself. So I left the office for a few seconds to quickly get a stethoscope from the nurse in the next room, because mine was, I left it somewhere. But anyways, I get my stethoscope, I listen to her heart rate, I check her pulse, I check, everything, the BP, everything seemed to be very much okay. So when her vitals were stable, it moved from or rather it moved from an emergency case to, okay, something else is going on here. So here's what you need to know about medicine. It's not really um 80%, 70, 60% is what they teach you in school, in the books, in your practicals, in your internships. But, there's another, let's say 30 to 40% that's going to be pure, experience. You're going to have to be more than a doctor. Sometimes you have to be a lawyer. Sometimes you have to be a pastor. Sometimes you have to be a counselor. Patients come in with, all kinds of issues, but the root cause cannot really be solved medically. Sometimes some issues are resolved with a conversation, which is what happened in this case. So I checked all our vitals, everything was fine, and then I left the room to return the stethoscope to the nurse, knowing that the patient was no longer an emergency. And when I was about to step back into the room, I heard her on the phone with her husband, and she was basically arguing with him, going back and forth and saying I wouldn't do it, I wouldn't do it, and all of that. And it was like an aha moment, like, okay, so this is where the source of whatever was happening is going on. So I look at her again, because you need to look at your patient physically to see what's happening, and she looks fine, just a little bit hysterical. So I go and I sit over at my desk, and I engage her in a conversation, like, okay, so what's wrong, what's really happening, like, why are you breathing very loudly and fighting for air in my office right now? I try to open up with like a joke and all of that, and she opens up and she tells me she's pregnant. And so you see, what most people don't know is oftentimes the women who go for abortions are not just the young um, women out there unmarried, but also married women. Some feel like they have a lot of reasons, they're not ready and all of that. So it's not just the women out there, it's also married women, which was a shock to me, coming to the profession. I thought it was just young girls out here wilding, but no, married women too be in the streets asking for abortions too. And it was just funny to me. So we continued the conversation, and she's like, she just had a child like a year ago, and she and her husband agreed that they would not have another one until they were more financially ready. But unexpectedly she fell pregnant, and she's about 2, 3 months along. And now the husband is pressuring her to have an abortion, which is also another common thing that I see in the medical profession. usually it's the husbands pressuring the wives to go get abortions. Like, oh, just get rid of it. Like, I'm not ready financially. I'm not ready, and threatening and all of that. And that was when she paused her story and looked at me like, okay, so, and I was looking at her like, okay, so, but then I did not bring, my faith into it actually. And, I just basically told her about the procedure, because another thing I noticed among my female patients is that they don't really know what they are getting into when they are going for an abortion. When I say that, I mean they don't know the procedures, they don't know the processes, they don't know the risk factors, they don't have all the information that they need before making that decision, which is the point of this video. We all know the definition of an abortion, usually within a time frame, because there's a designated time frame for a woman to intentionally, abort the fetus and all of that, right? So I explained to her, okay, this is abortion and these are the different types depending on how far along you are. So the earliest pregnancies, you have medications for that in varying degrees. And then in later pregnancies, there is, what's the term I'm looking for? I'll get it and I'll write it, but there's this okay, I think it's called a D&C. I don't know why I'm forgetting, I'm a whole doctor. But it's like a D&C procedure. And basically in the later stage, which I think that's where she was. I'm not quite sure. Again, the details are a bit blurred because this was a while back. So the stage where she was is the one where they would have to take her into the operating room and basically go up into her uterus with an instrument. I'm gonna have to find out all the names and just write them out, and basically kind of squash the baby into multiple pieces, squash the fetus into multiple pieces, and then one by one bring the pieces out of the uterus. And usually after that procedure, you get like an ultrasound to make sure that there's no single piece that is left in the uterus. Or what some doctors would do is they would arrange the pieces of the baby on a little tray to make sure, okay, what part is missing, what part is not missing, maybe we need to go back in and all of that. So I explained all of this in details to her, and her look transformed from hysterical to horror. She was like, girl, what? Like, nobody told me this, and I had to keep talking because there's more to this. So usually after women have abortions, there's always risk of, ectopic pregnancies, anything that actually involves the abdomen, abdominal surgeries, or any abdominal procedure. There's always risk if ahead there will be another surgery. That's why when you come for a surgical procedure that involves the abdomen, they usually ask you, have you had one before? So they'll find ways to mitigate any risk factors. I hope I'm speaking English that you guys understand. If you've had an abdominal surgery before, we usually want to know about it in case of any risk so that we as the doctors or surgeons could be prepared. Howla? We good? All right. Some women with abortive history could end up having infertility, and some kind of struggle with depression due to religious guilt, or just the fact that maybe in some cases like this one, they were pressured to do something that they did not want to do. So there's all sorts of depression and guilt and all of that. So I just basically laid it out on the table for her and sat back to see what she had to say. And like I said, her face was a marks of pure horror. And um, someone might be out there and they are at a place where they have to make a difficult decision, because abortion is not the way some media parades it as some sort of happy, oh my god, we get an abortion type of situation. For some women, in my experience, in my practice in medicine, it's not a happy decision. It's one where they have a lot of things to consider. There's finances to consider. They have a lot of other kids to consider, adding one to the mix, the mental load and all of that, or their husbands are pressuring them, or their families are pressuring them. Abortion might not even be the woman's own decision. It could be other people pressuring her. This video is for you. And I'll tell you what I've told some of my patients. I don't envy your position. I could, tell you, okay, what I know morally and, all of that, but I just want you to look at this from the place of God's heart. And that's the point. I want you to see his heart for you, that he is not condemning you. You being placed in this situation is not one that, in fact, I realized that most people would succumb to certain pressures when they are put in certain situations. So my point is, um, I see you and I understand that it's a very difficult decision to make. However, I want you to know all the nuances that are involved in this process before you make any decision that you want to make. So you go in fully prepared. You go in having all the information on the table. Now, back to the woman. What did she decide to do? Well, she her breathing magically returned back to normal. Her hysteria went down to zero. And she was like, yeah, I'm not doing that. I'm not going to go through all this because my husband is telling me that he does not want, this child. We're just gonna have to find a way. And to the men watching this, you think it's easy to just say, oh, go get an abortion. I think the extreme case I've had is a man not only telling his wife to go have an abortion, but actually buying a random street side abortive pill, making his wife take it, and she ended up in our emergency department bleeding into her uterus. I don't even know if that woman survived because we had to refer her to a more specialist care hospital. So men, I know that the financial burdens are high. At that point in time, it seems like everywhere is collapsing and you cannot just afford to have a baby right now. But it is ruthless and wicked for you to pressure your wife to you know, go and do it like it's just walking to a store to get ice cream, which is what this video is for, so that you can have all the information you need and then make the decision you want to make. All right? All right, guys, we have come to the end of the video. I will see you all in the next episode for another day. Bye.